NBC News medical contributor Dr. Vin Gupta joins us with more on this. Doctor, good to have you with us. So first of all, just how alarmed should we be about this outbreak we're seeing in Ohio?
Well, Joe, good morning. This is not a cause for alarm for the general population. The headlines are scary. They're evocative of what we saw in the early days of COVID-19, but they're very, very different. This is about 145 cases of pediatric pneumonia since the beginning of the fall in Warren County, Ohio. Average age about 8 years of age. There's been no deaths. And what we think is happening in Ohio is just the fact that we've begun to normalize life, frankly, since 2022, but that this is what we're seeing now. These bacteria and viruses that tend to circulate every 3 to 4 years are now impacting various parts of the world, including Ohio. That's why we're seeing this surge here. This is not because of an unknown new cause.
Mycoplasma pneumonia, what is it? How is it different from a normal case?
Well, Joe, I'm glad you brought that up. Mycoplasma pneumonia, classically also known as walking pneumonia, because many of us walk around with it, especially young adults, don't even know we have it. But elderly and young kids are most susceptible. It's a bacteria. It can cause atypical pneumonia, meaning you might not get as sick as you would with, say, the flu or COVID-19, but it can still cause cough, fever, fatigue, but it is something that can very easily spread because many of us may not even know we have it.
We're seeing this rising number of pneumonia cases in China. Is there any sort of connection here, or is China any sort of indicator of what could happen here in America?
The only similarity is that it's a surge, Joe, of various types of causes of pneumonia, whether they're bacteria like mycoplasma or viruses like COVID-19, flu, RSV, that now happen to be afflicting individuals like kids that haven't had immune systems develop either because they've been wearing masks in schools, like in the case of China, or just because some of these viruses and bacteria like mycoplasma circulate every 3 to 4 years. These are known causes of why we're seeing these surges. The headlines are scary, but luckily there's nothing new here.
Let's talk about what parents should be looking out for. What are the symptoms, and can they distinguish between a normal case of pneumonia and mycoplasma?
The answer to that last question is not really. Unfortunately, no. That's where testing is important. So what do parents need to look out for? If your child is having high fevers, over 103, if they're having a productive cough, shortness of breath, if they're more fatigued than, say, you would expect for their child, to get them seen by their pediatrician, critical. Keep them home also from school to minimize spread. If you're traveling, try to wear a mask, but get them seen because, Joe, to your point, a lot of these different conditions mimic each other. And in some cases, we have treatments like with flu or even with COVID-19 that if you were to get seen early and get tested early, you can get treated early. That actually helps keep people out of the hospital. So don't take anything for granted. If you're a parent of a child or if you have a loved one that's elderly, medically higher risk, get tested because a lot of these conditions mimic each other.
All right, some good advice. Dr. Vin Gupta, as always, thanks for joining us this morning.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.